So today I'm going to talk a little bit about the evolving role of Infoway and our strategy, give you some highlights and teasers into our strategy. And then there's going to be, as Lynn was mentioning, the opportunity to do a Q&A session. And on the app, I've already seen a few of those questions come in, but you can, whilst we're talking, you can upvote those. And particularly also if you're in the virtual conference, you can do the same thing. And I really don't want to forget anyone who's on the virtual conference. I think that's a great new addition to the program. And we've almost got as many people on the virtual conference as we have here in this room. And the great thing, just for me to be at this partnership conference, is to see that this year in Calgary, we've got the best attendance so far. There's, I believe, over 340 people here, 340 of you. Thank you very much for supporting this. And we've also got another 300 people online. So I think that's a really fantastic vote of support. And, it's been a great meeting. It's going to be a great meeting the rest of the time. And partnership is such an important core thing about what we do. Now, I joined Infoway about 3 years ago. And the thing that attracted me to Infoway is that I viewed it as a high-performing organization. And over the years, I've led organizations of different types, larger and smaller. Some were low-performing, and it can be a challenge to go into an organization that really needs a big boost to do something different. On the other hand, I think it's much more challenging to come into a successful organization and not screw it up, but also try and make it even better. And if I can help do that with the Infoway team, and in the end, the secret source of Infoway, I think, is really very much our people and also our relationships. And those are the two critical things, I think, that we can add and really try and make a difference. And so I'll try and kind of expand on that theme as I go along. And in the end, we are only 150 people. We don't run any health systems, we don't operate any hospitals, and so we have to see how we can best make an impact in a system which is, 240 billion plus a year system. We have got some substantial funding, but it's not even 1% of that amount. So how can we amplify that? And what I like to kind of think of really is that Infoway, I kind of come from a bit of a biochemical background, that we should be and take the role of a catalyst. All the substrates are there. All you guys are out there in the provinces and, whatever role you have in the system, if you're a vendor, work for a company, or if you're a software guy, or if you're a healthcare provider, administrator, and so on, all the ingredients are there. But how can we bring those ingredients together and hopefully make this reaction work a little bit quicker? And I think one of the things we've noticed during our discussion, we're all too well aware of, is that we all talk about innovation, but it's the speed of innovation, I think, is one of the critical things. And one of the things that I like to focus on is how can we make these things really happen? We talk a lot about innovation, but how can we really help you make it happen? And when I look at the role that Infoway has had, and I think this is also an important thing, if you want to become and maintain yourself to be a successful organization, you've got to be able to reinvent yourself to a certain extent. And you can see any organization that does well over time. We're operating in a continuously changing environment, and we need to respond to that by anticipating changes and changing ourselves. And this diagram kind of represents, in my view, where Infoway has been over the years since its foundation in 2001, and then looking forward up over the next 5 years. And we can see that the initial role of Infoway was very much working with the provinces to invest in this infrastructure to build all of those data repositories and registries and so on, and put that structure in place so that every province really has the foundational elements of the EHR, and you can all remember the Infoway blueprint. So I think Infoway provided not just funding, but also provided expertise and also some leadership in terms of how that could be architected to go forward. And so now our investments, that job is 99% done. It's finished really, and we need to look forward, look at the next steps. So then in the last few years, we kind of changed our focus to really looking at providing clinicians with the tools, EMRs and so on. And we've reached a stage now where primary care physicians, over 85% of primary care physicians now have an EMR. But what we want to do is help them, encourage them to use that system, not just as a sophisticated electronic filing cabinet, but really start to look at ways that they can help use these tools to improve care. And so that's our focus now going forward. We're focusing on physicians. We're also focusing on Canadians, on patients. And one of our key themes is driving access to care. And just for a moment, if we step back and we think, where would we like to be in Canada? We would love to have a system where you can access your health system with a mobile phone, or if you're not fortunate enough to have a mobile phone, we would find some solution to facilitate that. Where basically the providers have the tools so that they can really care for their patients, connect with each other and collaborate, where patients can also use tools like e-booking, e-referral, e-consult and so on to get a much better patient experience. And where basically teams can come together and provide a seamless patient experience. I think that is a vision that many people would have of what we would like to see with healthcare in Canada, and we don't think we're there quite now. And in fact, this particular slide is from the 2017 Commonwealth Fund report, and here it shows the summary of 11 different countries. You've got the UK in the #1 spot, followed by Australia, the Netherlands, New Zealand, Norway, Switzerland, Sweden, and Germany. And then below this average line, Canada is in 9th place, and you've got France in 10th, and then the US in 11th place. And we, I don't think, are happy to be in the 9th place. The good news is that the previous year, Canada was in 10th place. The bad news is, it's not because we got better, it's because France actually did worse. So we can't really slap ourselves on the back about that. But I don't think anyone is happy to be there. And the interesting thing is that one of the key elements that puts us in this position is access. Access to care, access to services. But also in Canada, a country where we hold ourselves up as being equal opportunities for all people, equity of care, equity of access, and we heard this yesterday, is also a huge issue. And someone did a calculation that even if you had national pharmacare and you also had free dental care, we still wouldn't go above that median point. So that's quite a shocking figure, really. And so our goal is to get to the #1 slot. And I think, how can we really move that dial, get us over that median line, and put us in the position we should be? Because we know the individual players. I mean, we have fantastic centers of excellence. We have fantastically dedicated people. We're putting in more than average money into the system, 11% of GDP, whereas the UK put in 9%. So there's really no reason why we should be in that role. One of the reasons, of course, is that we have a fragmented system. We don't have a single system like many of those countries above the line. The UK, for example, although it has 3 systems, NHS England accounts for 50 million people, so it's a huge system. Australia has a statewide system, but it has very good national coordination. Same in the Netherlands and so on. So those are some of the examples. So how can the federal government and also Infoway play a role to help the provinces boost their systems to kind of get above that line? That should be the focus that we have. In Infoway, we are really focusing on this access to care initiative. We believe truly that we should put patients and families at the center of everything we do. It's great to see that we have good representation from patients and patient groups here. We want more of that, and you guys have been very vocal in the Q&As, which is fantastic to see your voices come up. From the presentation yesterday in New Zealand, I was really impressed by the impact that that organization made by using social media and marketing to increase awareness and demand for good digital services. And I think that's a lesson that I would take away from that. And so we want to really, as 150 people with some money and a lot of skills, I think we can try and help the provinces work together and really identify the low-hanging fruit where we can start to modernize the system at an increased rate going forward. And I like to think, of course, the partnership side is very important. We can't do it on our own. But I kind of thought, as I was preparing this presentation, about the Olympics, for example. Now, if you take the UK, we all know the UK did very well in the Summer Olympics, but they suck in the Winter Olympics. And when people think about the UK and the Winter Olympics, they always think of Eddie the Eagle, this guy with his bottle glass lenses trying to do the ski jump, and they made a comedy film about it as well. He's a bit like Bubbles, type of character. But in the Summer Olympics, the country has done well. And the reason it did well, it put a lot of focus and investment into that. Now, in a similar way, so UK is #1 health system, Canada's down the bottom there. So it's a little bit like, maybe our health system for Canada is a bit like the Summer Olympics. But what we need to do is put the same kind of thought and investment that goes into the Winter Olympics into the summer, into the kind of summer side or our health system. And if you take the Winter Olympics, this is the women's hockey team, won gold in Sochi. Basically, the country has done a phenomenal job. 35 million people, but in Vancouver, Canada was #1 in the medal stakes. In Sochi, it was #3 in the medal stakes. And one of the reasons for this initiative is that the Olympic Committee decided to start with this Own the Podium program, which I think originally started in the US. But they basically set up a not-for-profit, and they really had the goal of what can we do to bring all the resources together to coordinate everything we have to make sure that Canada owns the podium. And I think that, I'd like to think perhaps Infoway and that organization that owned the podium didn't have any athletes working for it. It could influence the athletes, of course, through leadership and different ideas and investment and focus and everything else. And I think that's a similar thing that perhaps Infoway can help us own the podium from a healthcare perspective as well. Now, talking about our strategy, basically, over the last couple of budgets, Infoway has received $350 million. We haven't spent it all yet, and we're looking to really kind of distill these investments over the next 5 years. And we've come into 3 different program areas. But overall, our vision hasn't really changed. We feel that our vision is to see how can we help kind of create a position where we have healthier Canadians through the use of innovative digital health solutions. And basically, what we're focusing on is really focusing on this access initiative. We're looking at the triple aim of quality, sustainability, and access as a driving force between the initiatives that we have. And we have divided this into 3 particular goals that we're going to focus on for now and the next 5 years. And I'll talk a little bit about each of those areas. And the first one, yesterday you heard about the PrescribeIT initiative. And this picture shows, an example of a handwritten script that someone put in the washing. Unfortunately, it got ruined. But we all know the issue here. And, it seems to be a very easy thing to do, to connect that last mile, have that electronic script, make sure that we have a system that really, I think, as Bobby was saying, is a public utility, that we're operating this a little bit like air traffic control, where you don't want every airline and every province having their own system, because that could be a little bit dangerous, but you want one system that has equal access to everybody and is fair to everybody from a commercial point of view as well, also secure. And of course, once this system is in place, which will take a few years to do, we've started already in Ontario in 3 cities, and we're moving soon to Alberta. The work has gone in. It's just a matter of getting everything finalized to go ahead during next year. And we have 6 provinces signed up. We've got 3 more in the waiting, and we're talking to others. So I really do think this will be a great national initiative. It will bring us in line with other countries, but it also then puts in an infrastructure that you can do so much more with in terms of information, national pharmacare, and so on. You know, pharmaceuticals, as we all know, are a very big part of the health system, a very big cost, but also a big contributor to healthcare outcomes. So how can we help utilize that in a more effective and efficient way? And so that's one initiative. The next one is called My Health Gateway, and this is where we help to try and improve access to Canadians for their health system. And the goal, as I said earlier, we want everybody to be able to really run their health using their smartphone or another device if they have one, but also we want the professionals to be able to collaborate together with these tools, not just to view information, but actually do stuff with these phones, make your appointments, do e-consults and so on. Try to get more efficiency out of the system with a limited amount of resource. I put the gateway up here, the Golden Gate Bridge, because I think this is a method of connecting people. I was at a conference the other day, CD Howe, where we had a patient advocate there. She said, I've got several chronic conditions, and I've got 4 or 5 different personal health records. What I'd love to have is just one gateway where I could get access to everything. And I think this is part of it. This is part of the solution to help provide that common access point. Now, we know in many provinces, you may say, well, we've already got an infrastructure of personal health records and so on. In fact, Ontario, they've got 84. And so a lot of that work's been done. We're not trying to reinvent that. I think what we're trying to do is bring common services and common solutions that could be used across the country, but also would be of value to some of the have-not provinces and areas that have not been able to implement the technology. One of our values, I think, is to take great ideas that occur in one part of the country and bring them across the country. That is a huge value that Infoway can give in terms of having our overall reach. This initiative is going to be an initiative that will involve partners from industry, partners from the provinces, the professions, the regulators, and we're taking a lot of international feedback, looking at other examples where these initiatives are going on in the UK and so on. And over the next few months, we'll really be rolling out this initiative in a big way. And the next 5 years, we'll be working with our partners on putting together a really good program. We've done an awful lot of the background work to kick this off. And this is one that from now on, you'll see My Health Gateway, if we continue to use that name, will be something that you'll be recognizing and hopefully will represent some very useful tools for patients and also for caregivers as well. So watch that space. It's going to be a big collaborative effort. And then the other area, the final area, is the Centre for Digital Health Leadership. And I chose this picture of Charles Hamlin, who is an Olympic speed skater. He's won 4 medals. I think it was 3 golds and 1 silver. And this was a picture from the last Olympics when he was winning the short, the 1,500-meter race. And, I think like any athlete who puts in, it's a huge team effort behind someone like that. He's not doing it on his own. He's reliant on his friends, family, his trainers, and a whole infrastructure of support. Now, Infoway over the years, as you know, has taken a leadership position, first of all, with the blueprint, in looking at things like methodology to deploy solutions, looking at clinical leadership, peer groups, and so on, working with professionals and patients as well, to see how we could best help change. And one of the key elements, really, that I mentioned earlier, all the ingredients are out there. We don't have a shortage of innovative new ideas. What we have a shortage of is how can we implement those ideas. And again, I think what we want to do in Infoway is kind of distill this leadership from around the country, and we will tackle big topics like privacy, for example. let's really, you know, we have a lot of expertise within the organization. We have the ability to bring people together from across the country. So let's really work on how we can come up with a great solution to liberate this data, to get rid of those damn fax machines and so on. We can also focus on areas like security as well. That's a very big topic, of course, and many other enablement factors, perhaps payment models. What is the best payment models to reimburse physicians for using these tools? Can we take the best practice from one area of the country and help spread that across the country? So I think there are a lot of very key enabling topics that Infoway can help provide a leadership position to, and we can help publicize, but also bring together the experts, as we are doing at this partnership conference today. So that is the kind of third leg of our strategy. And now I'm really coming up to the end of my presentation. The goal we have, as I mentioned, is driving access to care. That is the key theme that we will be pursuing. We're pursuing it in the area of e-prescribing. We're going to be pursuing it very aggressively in the area of giving Canadians access to their data and also tools to manage their health with our Gateway initiative. And then furthermore, we'll be looking at best practice nationally, globally, internationally, and seeing how we can set Canada apart from other countries and move us up from the Summer Olympics into the Winter Olympics of healthcare. So that's my talk today, and I think we have got some time for questions. I know there's some on the app, and I believe that Sheila's going to join me and be very happy to answer any questions you may have. Thank you very much.
So just to remind you before we start the Q&A is that Ask Michael, the app, you can submit some questions. I've got them here, they're on the big panel, so we'll start with the ones that if you like a question, you can vote it up. And we'll just start at the top maybe and go down. There's some questions I've been sort of reviewing, and I'll try to sort of lump a few of them in there. So you can see from a digital health perspective, and you talked about this a little bit, and you mentioned a number of sort of key goals and priorities. What's the biggest priority for Infoway?
I think the biggest priority, I've already said it, is to help improve access to healthcare and to really work with the provinces to see how we can enable this in an efficient and effective way that we can. Okay.
Oh, look at that. So we have a tie for first place. Okay, so and you asked this of the board members yesterday. So
right.
they're putting you now, flipping the direction. So if you were health minister for today, what's the one thing, what's the one change that you would like to make?
Well, apart from giving Infoway a lot more money, you know, I think I would try and look at what could I do federally to help enable better delivery of healthcare in the provinces. How could we really contribute in that area? And perhaps could the federal government take a leadership position in some of these areas, like, you know, eliminating fax machines, like maybe making e-prescribing, you know, a mandatory service that we would put in place. So I think, how could we look at influencing policy directions in a fundamental way that would really help enable change?
This is a bit related to that question. It's, you know, what actions will Infoway take to deal with the policy, reimbursement, legislative barriers to implementing digital health? I mean, that's, you know, we talked yesterday, and I think Catherine Hanna sort of said it like it is in her usual style in terms of that. We've got privacy, we've got reimbursement, we've got procurement. So any comments on that perspective?
I think, I mean, the privacy side, you know, we're investing in our privacy team. We have a new leader in that area. And this is, you know, a very big topic, and one that, you know, I think we will make a concerted effort with, both with the jurisdictions, with patient groups, with the regulators and the professions. And I don't think it's going to be an easy solution, but I really do think we can come up perhaps with a good model and then try and promote that model across the country with all our stakeholders.
You know, the next question is about, you know, and you mentioned it a little bit, and it came up yesterday with respect to access and the equity issues. So the question is, there'll be a portion of the population that won't adopt technology or new ways, whether they don't have the desire to or the willingness to or the ability to. So what strategies would be considered to ensure equal access from that perspective?
I think that's a very good point, and we certainly need to find ways of doing it. I think there are some methods where you can bring, technology to remote locations, perhaps into an institution like a school or something like that, which has been done. There are tools that we have done some investigation looking in the US at the activities of some not-for-profit organizations that serve what they call underserved populations. And their finding is that, for example, simple texting, you don't have to necessarily have a smartphone, but a simple texting on a relatively low-cost device that could be distributed can provide a lot of assistance. It can actually provide specific support for individuals with particular illnesses, maybe health coaching, reminders about visits, and there are some really good outcomes. And we're going to hopefully work on a program with an organization called Kids Helpline, where they have built up a reputation for providing telephone support to troubled youths from a mental health perspective. And they now want to take this into the area of texting and into social media. There's evidence, I think, that, as I mentioned, that texting can provide real support. But I think it's a challenge that we've got to make sure that at least the care providers will have access to these tools, which could certainly, from a health equity point of view, cause a lot of improvements. As you know, for First Nations, we ran a successful program with the Korean tribes, putting in a personal health record, my Relay Health from McKesson. And that system has enabled people in that area to get access to their professionals, to the e-consulting and so on. I think we are looking at working with the First Nations group to see how we could extend those type of facilities broadly across the country.
Great. I think people forget too that technology often can be used to increase access to not
Absolutely.
just, one of the questions here is around, there was some discussion about the prospect of a virtual hospital, and in some of the panels yesterday. Comments around, is Infoway planning to create a virtual hospital?
I'm keen on that idea.
I know.
And, it's something that my team were a bit frightened I might unveil it straight away. But yeah, this is something I'm really looking at, is to perhaps work with some partners and look at this virtual hospital program. There was mention yesterday that some of the US health systems now are doing 51% of their visits by virtually, or 51% of patient encounters. A year ago, I was in Boston, at Boston Kids Hospital, and they have a real strategy for their virtual presence, over and above and outside their brick walls. I think it could be a way that we could really pioneer some great delivery methods, especially in specialist areas like pediatrics, cancer care, and so on, with that virtual hospital kind of technique, and also benefit Canadians in remote locations, get better access to key centres and so on. So it's an idea that interests me an awful lot. Yeah.
You heard it here first, folks. So this is maybe along a little bit of the same lines. And I was talking to Andrew Slater yesterday, and he said, you can tell the value of a keynote by the number of times that they're referenced throughout the day. And I think people were really impressed with that home medical care, even though it's not necessarily the best name. But the question is, could Canada Health Infoway potentially, or do you think that could be replicated, that model could be replicated in Canada? And maybe, the question is make Canada a true agent of change. But, and if the answer is yes, in terms from that perspective, then what would be different, and how would Infoway have to evolve to that model?
That's a complex question. I think it's a great example.
Not my question.
Yeah. It's a great example that I think we should aspire to that, and I would like to learn a lot more about that solution. Canada and New Zealand as well, we have to remember that Canada is a larger population, 35 million, 13 different health systems. So there are some more complexities, but I don't think that should be a barrier for doing that. I think we could certainly work with the provinces who may wish to stand up that type of service. I think there's a role that we could provide to help facilitate it and to promote it. I really do like the element of focusing on social media, because I think the big agent for change will be the public. If you look at private sector, it really is, if you look at the retail sector, for example, moving into e-commerce and so on, online purchasing, and places like Sears that have been there for years closing. And that really is because customers are choosing to work in a different way, in a competitive market. So can we bring that kind of consumer power to healthcare? I think with electronic tools, we've got a possibility to do that. And through social media, it should be much easier to really make health a much bigger, visible issue and get, participation, advocacy from everybody in this issue. We can put it on the map, I think, in the way that they have in New Zealand. I think that's an exciting challenge.
Good. This is an interesting question and changes directions a little bit. The comment is Infoway has presented itself as the Switzerland that is performing a neutral role. But given the level of corporateness that's through sponsorship, et cetera, and the relationships we have, the question is that characterization disingenuous or even possible? Interesting comment.
I think the danger of being neutral is that you could be bland. And so I don't think we should be neutral, but I think we should be fair. And I think as a not-for-profit, we're driven by, I always like to say, we're driven by purpose, not profit. And that's a great thing to have as an organization. I think we can really help work with private sector companies, and in the end, you can't work with every company. We have to try and choose the best companies to work with, using as fair a process as we can have. And I think the ability that we've got is that we're representing the provinces, we're representing Canadians' interest in these endeavours. And so it's up to us to try and make the level playing field and keep that fairness there. So I think we want to do some good stuff, and we want to do it for Canadians for the right reasons. And if we have control of data at any time, we want to make use of it for the best, to enable other organizations like CIHI and so on to use that information for the good of the system and the good of care.
So you're talking private-public sector?
I think that certainly the private-public sector, there's a definite role. And I mentioned, yes, if you look at it, physicians deliver cures using private sector innovations, whether it's drugs, whether it's medical devices. And I think companies, shouldn't just bring the product, they should bring the solution and be held accountable for that. We're also looking at some risk-based models like social funding and so on, where we could actually fund programs based on outcomes. So we've looked at, remote patient care, for example, where we've done some work with OTN for various chronic diseases in the areas of congestive heart failure, COPD is mentioning a couple. Those studies have really proven that it improves outcomes, improves patient satisfaction, and also lowers the cost of the system by reducing ER visits. So could we come up with a funding model then that would kind of really be based on those outcomes? And you pay if you get the outcomes. And I think the private sector are willing to make that kind of investment and should be held accountable to get the results from their services.
Coke or Pepsi?
Yeah.
Coke or Pepsi?
Coke. I'm a Coke guy, yeah.
That wasn't a real question. I just thought I'd throw that in. This is an interesting question about Infoway and work with federal populations. So Department of National Defense, FINIB, veterans, corrections, Indigenous populations. Can you talk about how Infoway would work with them or could work with them to help strategies?
Yeah, we do some work now with those organizations. One example perhaps is in the area of public health, where we have our Panorama initiative that 6 provinces are using and 2 more are about to implement. So this is health, surveillance, looking at vaccinations and inoculations and so on. We're trying to work with Public Health Canada to see how we could collaborate together more on a national basis in this area. Recently, we met with the Department of Defense, and they're looking to renew or review their digital health strategy. And I think that could be a great kind of test environment, you know, to go forward. And then where we're looking at strategies, if you look at the area like mental health, there are a lot of e-tools, digital tools that are coming up. There's a lot of programs in place, there's suicide helplines and so on. They may be run either on a provincial or federal basis. I think Public Health Canada are running one of these programs or about to launch. But what it would be interesting is that, you know, Infoway, we're not experts in mental health, but I think what we can do is work with these organizations, perhaps do an audit to see what is the state of the nation in terms of tools for mental health. How could Infoway then work with national organizations to help provide a better coordinated strategy going forward? So I think there's great opportunities to work with national organizations.
Okay. This one is a bit of a, it's a security question, and you know, Kevin McGee yesterday noted how insecure all our data is, and sort of said that we have no idea what our data is being used for and how insecure it is. So the question is, how can we ensure that PrescribeIT will be secure? Well,
TELUS absolutely tell me it's totally secure, and I believe them. And but apart from that, I mean, we selected TELUS as our partner, and for a number of criteria, and their capability in delivering the solution, you know, in the way that we wanted it to deliver, and their competence in this area. And the security aspect was a paramount part of that decision making, because the whole integrity of that system is based on security. I think there are issues. If you look at EMRs, for example, you know, a lot of doctors' offices are using EMRs on their personal computers, possibly running on XP and so on. If you could move those into a cloud environment, maybe that would be a much more secure environment. We should really focus very carefully on security. And I think you can't underestimate the risk that that could offer, especially as IT solutions become more kind of invasive in kind of delivery of health technologies. So I wouldn't, you know, I think we have to keep on our toes all the time on the security effort. We've seen in the UK, for example, how they shut down several hospitals with one of those ransomware attacks, and we've got to, you know, really see again, can we help working with the different agencies across the country and ensure that we've got a secure system.
Maybe worth mentioning here the partnership that we're doing with Healthcare Canada is responsible for doing the cybersecurity.
Absolutely, yeah.
And so we're sitting on their steering committee, and they're taking on behalf of health a federal initiative on cybersecurity. This is a bit of a question related to PrescribeIT, but the gateway as well. So could you elaborate more on the My Health Gateway concept? And then the subsequent question is, would Infoway consider the partnership model used for PrescribeIT here?
Yes, so I mean, this is exactly the kind of model we're looking at to find what is the, you know, next PrescribeIT in a sense. And the My Health Gateway concept does lend itself very much to that kind of approach. We're looking to, as I mentioned before, to partner with some of the best companies with the best technology, and over the next coming weeks, you know, we will be looking at that. In fact, we're in the middle of that processing, doing the technology evaluation. But I think the key is to find a real, you know, solution that we can, you know, hang this on. And you know, in the end, My Health Gateway, like PrescribeIT, you know, PrescribeIT is successful because it's a good system. It's a voluntary system. No province has to use PrescribeIT, but they've all decided to use it. So I would like to have a similar approach with My Health Gateway. We've got to find that kind of secret sauce, the real crux of the solution, that we can basically offer advantages, you know, to consolidate these systems together, to have a common platform. One of the goals with this type of solution, and we talked about the you know, kind of ecosystem, innovation ecosystem. So the concept with My Health Gateway is that imagine if we had a system where provinces can subscribe to My Health Gateway. We will connect in, using that platform, all of their EHR systems and so on. So then if you have a solution, e-referral, e-booking, you implement it in one province that's got that solution, then it can automatically be used anywhere else. It will be standards compliant with any other province that's connected into that network. So it really does build upon the investments that we've made together with the provinces and the federal government over the years. The idea is to have this common platform that will really be a platform for industry to develop new cool apps and provide them, and also for the public to be able to, for patients to have access to their data, to be able to contact their physicians, to be able to do an awful lot of great things to improve their contact with the system. The system itself will thrive with all the innovative partners that will join this program. We know that there's a number of initiatives across the country, again, in the area of innovation, where you see various different organizations that are accelerators and so on, encouraging innovation. How can we bring those organizations together in partnership so they can all work on this kind of platform? You know, the data that's coming out of health systems is very siloed. How can we really make this accessible to physicians at the point of care when they're seeing a patient? How can we use it for predicting trends, for provinces to really help them plan and improve their healthcare priorities going forward? So I think there's so many applications that are really crying out for this kind of approach. You know, the benefits of doing it across the country, but having local benefits at every touch point are the kind of important things that we can put together in a similar way, I believe, that we've done with PrescribeIT.
Great. A couple of questions here on innovation. What is Infoway doing to support pockets of successful research and innovation being done across the country? And then a similar question, what is Infoway doing with respect to innovation? Do you have an innovation lab within your organization?
Not yet, but that's a good idea. So we like to think the country's our innovation lab. So, again, I think a little bit like our New Zealand organization, we're working with innovative partners in technology. We have got technology people in the organization, but the key is to how we can kind of unlock that. Over the years, we've done a lot of work working on local innovation. We've done various different challenges and so on where we have helped people pioneer new technologies. And though in a sense, although we like doing that, what we want to try and do more of, as I mentioned earlier, there's a lot of great innovative ideas out there. Canada is renowned for being a land of pilot programs. So our role, I think, is we're not really in that business. I think the innovation we want to spur is the scaling up. That's the kind of innovation in care delivery using technology rather than coming up with technology itself. However, it's not to say that there are some technologies that, on the one hand, we want to get rid of fax machines, which should be a fairly basic thing to do, doesn't need new revolutionary technology. But we also do want to look at revolutionary technology. I think particularly in the area of big data and analytics and so on, these technologies are going to have a huge impact in care. And it's something that we shouldn't ignore, and I think we should definitely pursue some really exciting initiatives that will move the dial to a new kind of care delivery.
I like the idea of what Andrew was saying yesterday, that they have sort of a pocket of money, that they're not accountable, sort of that's their innovation play. That's nice to have that kind of flexibility.
Absolutely.
Yeah. So a couple of questions back to PrescribeIT. Will PrescribeIT work in the far north, or is high-speed, reliable digital access required? If so, does this mean that those in the far north, rural and remote Canada are at a disadvantage? Can agreements with telecom companies and providers offset higher costs? So it gets again to that equity question. But I think also around PrescribeIT, what will it take to make that run?
Yeah, I think certainly it needs to be a national solution, and we've got to find solutions for everybody. I think there's probably a lot of very good use cases for technologies like PrescribeIT in the north. And could be in the future maybe in terms of delivery of pharmaceuticals and so on and so forth. So definitely this is a program that is for the north. I'm not fully aware of all the different technology issues in terms of accessing and network availability and so on. But we would try our utmost to work with the telecom providers and the communities to see how we can extend this service to everybody.
Question here around federal mandates. And I think can we federally mandate provinces to fix pay for medical professionals? So can we reimburse them for digital health tools and use of digital health tools? So I guess a couple of questions in terms of, what's your opinion in terms of the reimbursement model, and then what kind of levers do we have short of mandating, which we don't have?
I don't think we can mandate. Certainly Infoway can't mandate it, and I don't think we want to get there. But I think we can certainly look at best practice internationally, also where it's working well in Canada. There's a lot of questions about, is the fee-for-service model is not really a good model for going forward. Maybe it should be more a capitation model where physicians are paid a fixed fee for looking after a population. Some countries introduce incentives if the family physicians can actually improve the care, get less diabetics and so on and so forth. So health-driven incentives could be an interesting thing. I was speaking to a family physician the other day who is on a capitated basis, does get paid a fixed fee for looking after his patients. And he felt there are pros and cons, that, in the end, his goal is to look after his patients. He still overworked whatever system that he had. I think there are some downsides to looking at salaried physicians as well, that, then you get into pensions and other areas. So it's not necessarily going to be the cheapest way to go. But certainly, I think if you look at the US and you look at some of the ACO models where they're basing really very much on outcomes, and I think the fee-for-service model doesn't focus on outcome. It's a activity-based funding model. I think we should try and drive where we can to models that really do reward based on getting good health outcomes. What Infoway can do, I think, is work with the provinces and where others, the colleges as well, to help this debate go along and really try and find some good solutions. So I think, again, perhaps we could try and catalyze some of that change. And we don't directly employ the physicians who are delivering care, so we're not involved in the labour kind of discussions that a province might be involved in. So we can take a more neutral stance, Switzerland type of position there, if you like.
Switzerland with friends, corporate friends. So question around PrescribeIT again. So a couple of them. What is the nursing population? How does that fit into the e-prescribing plan? So nurse practitioners
Sure.
and nurses that can prescribe.
Certainly, absolutely. I think nurse practitioners would have access as prescribers. And initially, as we've said, our focus is on getting the system up and running really with family physicians. But other providers and other settings are also in our sites, moving that to the hospital setting, moving it to other prescribing groups like dentists and so on.
Right.
So ultimately, we want to link everybody up to that system. And maybe in the end, it just won't be prescribing drugs. It could be prescribing an app, for example. That could be or a physiotherapy course or something like that. Maybe that could be an extension of the program.
Great. So another question about PrescribeIT, but not really just PrescribeIT, around funding. Can you talk about how much of the $350 million was or will be allocated to PrescribeIT, and similarly the other two areas of focus? So how are you allocating that $350 million?
For PrescribeIT, we had a very, precise kind of 5-year plan, and so that requires $150 million to get to where we want to be in 2022, which I think is about 6% of the population being covered by e-prescribing, and hopefully we can exceed that if that's the case. So then the rest of the funding, the $200 million that is remaining, that will be allocated across the other programs. And we're also looking at other sources of funding outside of that. Again, hopefully we will persuade the federal government to give us future funding for these initiatives. And we're looking at other sources as well. As you know, PrescribeIT has a sustainability model in it, where once the system is in place, within 5 years, it will be, the operational costs will be self-sustained by a subscription fee basis. overall that fee is justified by the improvements, I think, in delivery and efficiency and so on. So that could be a model that we could apply to some of the other programs that we're looking at.
This is a question that I actually asked Andrew yesterday from New Zealand, and I think it's just that, we even had a smart startup alley here, and there's just tons of innovation on the marketplace, and people are really getting into the healthcare space. So what suggestions do you have for how do you vet the best solutions, and how do you, ensure that they don't disappear overnight is the actual question.
Well, I mean, part of it, I think, would be, maybe we should take more of a survival of the fittest kind of approach. The good solutions are the ones that are going to sustain. And, the process for vetting them, we've done this in the past. We've kind of involved expert groups and third parties to help us, academics, patients, doctors. I think there are various different ways you can assess technology. Also, we can just do our own kind of, thumbnail type of sketch, what sounds really cool. You can have a kind of gut feeling there too. I think there's different ways of assessing technology. Other organizations may be better at doing that than us, and we can rely on those kind of third-party endorsements.
I'm going to read this one verbatim because does Infoway's access to care initiatives include the premise of an interoperable ecosystem where information follows the patient through the system and is ubiquitously available at any point of care?
Yes.
Pepsi.
So basically, that is the answer was yes. So that is the strategy with the Gateway program. That is exactly it, that the information will follow the patient at every point through the system.
And so I guess a related question, and it sort of talks to the vision for the Gateway in terms of this new national platform. Rather than launching a new national platform like PrescribeITTM, can Infoway help to federate regional or other branded platforms that already exist to achieve the same goals?
Absolutely, absolutely. I think that we're not in the business in reinventing things that work well, and I think the success of this program will be the fact that we'll be able to integrate those systems. So if there's some great work being done, as I know there is in Alberta, for example, that should be something that could integrate into this tool that could benefit others, but also hopefully we would help Alberta provide a better delivery and more success with that system as well.
So quite a few questions about patient involvement. So what can Infoway do to promote wellness through digital tools and social media? What platforms can we use to promote pan-Canadian engagement? It says, I don't hear much from Infoway engaging provinces and jurisdictions, clinicians and leadership alike, pan-Canadian communities maybe. What is Infoway's platform for pan-Canadian engagement? And how can patients play a bigger role? So sort of engagement, patient involvement, maybe the question was about, can you define co-design and what we mean by that? So maybe a bunch of those questions
I
together.
think that's a very good question. Events like this, I think, contribute towards that. And I don't have all the answers. I mean, as I mentioned earlier, I really did like, and I think many of you did, what's being done in New Zealand, that kind of real focus on the marketing side. I mean, you can't underestimate that, how important it is. And using conventional TV advertising and so on is very difficult to do. But I think with social media, there's a great opportunity for us to really kind of involve people in that dialogue going forward and give a lot of visibility to some core issues. And I'm open to ideas of how we should do that. I have a feeling that we should invest much more in that area, not just dollars, but also expertise, bring people on board that can help us improve our presence. We have, Poonam, who kind of works on social media programs. We've done some very successful programs. The myth-busting one was one. I think we're covering that a little bit in this session. And we should do more. We should definitely do more in that area. And I'd be very open to any suggestions that people may have and recommendations that we could take on board.
Just as the one responsible for those social media campaigns, just remember what Andrew said yesterday about it might be uncomfortable for you to do that. In fact, when we got the first protest call from the physician group, it was sort of you've made it. Okay, maybe last question. So what can I as an individual, I think this is a nice question to wrap up on, what can I do as an individual to promote change in an area where change is so slow to come because people have become really comfortable with the status quo?
Anyone as an individual, is that?
Yeah. What can I do as an individual?
Well,
what can
I
we
think
each do tomorrow?
I think we could all download a health app on our iPhone, and we could really start that dialogue. We could go into our family physicians and, demand, why aren't you emailing me? I think we should become advocates individually for the system, and really promote the benefits, the change. There has been some, in some countries, it's a no-brainer that technology is going to be used to solve these problems. Still in Canada, there are people who don't believe that. I think we've got to kind of dispel that belief, because the smart use of technology is definitely a way to succeed, but it's got to be smart use of appropriate technology. And every one of us can be an advocate for that approach.
Great. Well, thank you, Michael. I think it was, I think, ladies and gentlemen, that, the partnership was the first sort of opportunity for us to sort of launch the strategy, and Michael was very forthcoming in terms of what our goals are and the access to care focus over the next little while. So appreciate you being willing to answer these tough questions and making it available. So thank you very much,
Great,
Michael.
thank you.
And thank you to you for your
Thanks,
attention
everybody.
and your great
Thank you.
questions.